Okay. Good morning. I know we're on a bit tight timeline for everybody, so we're going to get right into things here. I have with me Dr. Eileen DeVilla, who's the Medical Officer of Health from Toronto, and of course Dr. Yaffe, Associate Chief Medical Officer of Health. I'm going to start with Dr. Eileen DeVilla is going to give you a summary of the new presumptive positive case, and we'll leave some time for questions if we can at the end there, so we'll move through things. So over to you, Eileen.
Okay, thank you, Dr. Williams, and good morning, everybody. As you've heard, we have a new presumptive positive case, and effectively, as you've seen through the news release, it was on February 21st that we had an adult woman, a woman in her 20s, who arrived in Canada after having traveled in China. And in that travel to China, we know that it did include some travel to Hubei province and to Wuhan in particular. However, as this young woman in her 20s arrived, we know that she had had an intermittent cough, and in fact that cough was improving and had been resolving for a couple of weeks now. It's interesting to note as well that the individual, despite the fact that they had an improving and resolving situation in terms of their health, she did wear a mask during her travel. When she arrived in Toronto, she was given instructions at the airport to contact Ontario's Telehealth information line, which she did. And when she described her history of travel to the affected area, and she described her symptoms, which were resolving, she was referred then by the telehealth line to hospital. So with that, the person presented immediately to North York General Hospital and was managed there, having had the history, with all the appropriate infection prevention and control procedures and protocols. She received a thorough medical assessment and COVID-19 testing was initiated. However, given the individual's health circumstances and given the fact that she actually is resolving and is quite well, the patient was discharged, was told to self-isolate, and I'm pleased to say is presently recovering well at home and in isolation. I think it's important as well to note that since arriving in Toronto, the individual has had very, very limited exposure to others. Our staff at Toronto Public Health are following up directly to connect with this individual on a very regular basis, and we are monitoring her symptoms. We will clear her, as has been the case for others, as non-infectious when we have 2 tests taken 24 hours apart, showing that the person no longer has any virus. I at this time can also tell you that our Toronto Public Health team are actively following up with close contacts of this newly identified case, as we have with the previous cases that we've seen here in Toronto. I think it's very important to note that the whole process that has been followed from start to finish here shows that in fact that the system is working quite well to keep people safe. We had an individual who had a relevant travel history and symptoms associated with COVID-19, followed all the appropriate precautions, informed people, wore a mask, has limited exposure to others, and I think that is all evidence of the system working well to keep residents safe, and as such, at this time, the risk here in Toronto continues to be low. With that, I'll turn it back over to Dr. Williams.
Thank you, Dr. DeVilla. I think those are very important notes of the system performing well. And I think that just gives an example of how this is ongoing. Even North York General Hospital, we work very closely with them, and they did exactly what they're supposed to do in the right time. I'm going to ask Dr. Yaffe now to cover the Ontario and global numbers in quick summary, as well as comment on some of the further testing of this individual, as well as things going on at the federal, provincial, territorial level in this changing situation on a global perspective. Over to Dr. Yaffe.
Thank you very much. Good morning. So I'm not going to go through all the numbers globally, but I will say that we are particularly closely watching some countries where there seems to have been quite an increase in cases. South Korea, with this morning 833 cases, of which there have been 8 deaths. Italy, 226 cases with 5 deaths, and Iran with 61 cases and 12 deaths. As well, some countries have been added today, Kuwait, Iraq, Afghanistan, and Bahrain, all of which cases had a travel history to Iran. So in terms of Public Health Ontario laboratory testing, they are continuing to test. At this point, as of this morning, there have been a total of 540 negative tests. 9 are currently under investigation. We have the 3 cases that are now resolved, and we have the 1 new presumptive positive, which you just heard about. In terms of this new presumptive, the first test done by the Public Health Lab came out borderline or inconclusive and had to be repeated, and are now at the National Microbiology Lab in Winnipeg for confirmation. And I think it's interesting to note that this is similar to what happened with the case we had in the young female in London, where it was, again, a younger person, a healthy person with a mild case, and that case resolved very quickly. So that's pretty much what we're expecting with this one as well. It's a low positive test. How risky or not that is, we're taking precautions, but it's probably very low risk to others. And as we've heard, she's already her condition is resolving. In terms of the federal, provincial, territorial work, the technical committee and the special advisory committee are all meeting early this week to consider what is happening across the world and whether the case definition should be altered. Thank you.
Thank you. And on our situation here in Ontario, the Trenton cohort, we continue to do testing of some individuals. All those tests have been negative, as well as the ones at NAV Canada and Cornwall. And the second cohort is due to be released tomorrow. So that's also good news. And the NAV Canada one, it's day 4, and that's progressing well, and that like there. So I think the aspect we're trying to deal with there is that we have in Ontario where we have our person under investigation. We also have ones where we allow healthcare practitioners, if they have areas of concern that they want to bring forward, they can order testing. We have not stopped them from doing that, and so we're allowing that wider surveillance modality. And of course, we're going to be addressing, along with our federal, provincial, territorial partners, how we should continue to expand if we have areas of risk and how we're going to assess that, as well as we're continually assess what's the status of a pandemic response on a Canadian perspective, but on a global perspective, waiting for the updates, as you heard some recently from the WHO, and we're going to keep monitoring that as well as with the Public Health Agency of Canada. So with that, I'm going to open it up for questions because I know we have limited time this morning. So any questions?
When you say that you're following up with the people that she was in contact with on when she got home or on the, does that include on the flight, and what exactly do you mean by following up?
So this is what we do in respect of every infectious disease. We try to understand who might have been exposed to somebody who has actually been identified as infected, say in this case with COVID-19. So yes, it includes those who are within a close range, close contacts identified from the airplane, and anybody else in Toronto. This individual actually has very limited household contacts, and we are actively following up with contacts from the plane. And given the existing travel circumstances now, there are actually very few plane contacts to follow up with, but that is in progress right now.
Can you elaborate at all, excuse me, on her travel history? You mentioned she had been to Wuhan, but also this, now we're in late February and Wuhan was quarantined quite some time ago.
So at a high level, this individual had traveled to China at the end of last year, was in Wuhan and Hubei province earlier in this year, in January, prior to the shutdown. Managed to leave, was still in China thereafter, returned to Canada on February 21st.
So just other areas of China?
That's correct.
Dr. DeBell, can you just describe again, I know you guys have, what does, on the flight, what does close contact mean? Like how many rows are we talking about? How many people are we talking about?
So the scientific advice that has been provided to us through our colleagues at Public Health Ontario suggests that at this stage of the game, we're looking at 2 persons away from the case in all directions. So that's the current best available scientific advice.
Because we are talking about droplet spread, we're looking at that 6-meter perimeter.
6
foot.
6 foot.
I know
2
you
meters.
guys have talked a lot about the concerns that you see with the spread in other countries like Iran and Italy. Can you just talk about why you believe things seem to be relatively under control here in the cases, while it's kind of increasing in other countries, it remains low and in control here in Canada and Ontario?
It's a good question. I think we don't want to be complacent just because that's the case. We want to keep looking at our surveillance, keep encouraging citizens and individuals who are returning, because most of it still is travel related, coming back into the Ontario perspective and coming forward if they think they have concerns and issues. We don't want to discourage that. We want to encourage that. We want a system that's ready to respond to that, and we continue to address that to see how we can make sure that that is occurring in a timely way to allow our different partners to take part in that, protecting the privacy of the individual without discrimination, that kind of aspect there. And that seems to be working for us. As far as others, it's a little hard if they don't know where the source is coming in. I think they're trying to catch up on that. I understand in Italy, where was the index case? How did it enter into the communities? What parts? This is our challenge, and this is why you have to always have very enhanced surveillance systems to be as sensitive as you can, allowing for the aspect that we're still dealing with travel related. We have not had secondary spread in Ontario. Those countries are dealing with that as we speak, and they have much more of a challenge to handle and see if they can contain it in their respective jurisdictions. And that's why the Director General was concerned back 2 weeks ago about declaring a situation, because are all the countries looking at their status? How are you prepared? What is your infrastructure to handle this and to contain it within your own jurisdictions? Some are better prepared than others. We trust the WHO to keep monitoring that, working with Publication Canada to tell us who needs to be concerned and what are our risk factors that we're going to add to our list if that is indeed the case. And so that's a lifetime discussion, as Dr. Yaffe has said, with the federal, provincial, territorial partners. So it's a dynamic dialogue and continually ramping up and being prepared.
Does this mean that you're looking at possibly further quarantine measures with people returning to Canada from some of these countries where we're seeing these sort of spreads?
Well, our current situation, we have a person under investigation. We have different methods where people are in isolation or monitoring. If people have history of contact with high-risk areas, as in the case of this individual here, they're in contact with public health, they're asked to go into self-isolation, they're monitored, they're tested, and depending on the results of that, going forward. So we are doing that on a case-by-case basis rather than carte blanche large, except in the case of the ones we've worked with the cruise ship out of Yokohama, and as well as with still citizens returning from Hubei province are still supposed to go into self-quarantine right off the bat and monitoring with public health, and travelers from China. So we have a varied amount, and so we are putting people into self-isolation, if you may, in home quarantine, and being monitored by public health when appropriate, where they meet the risk categories, and we continue to address those and discuss those at our federal, provincial, territory levels to see can we be consistent with our partners across Canada and with our international partners as well.
I think you kind of touched on this before, but the limited exposure to the other individuals upon return to Canada, just in a nutshell, just put in a bow, what that, I get, whatever you can, details you can give about what kind of contacts there were and how light concern there seems to be about that. Just put a bow on that.
Sure. So the best scientific advice in respect of managing or identifying who are close contacts on an airplane, given a respiratory virus that is, believed to be transmitted through.
And then when she got back. When the individual got to.
I'm sorry. This is here in the city.
Yes, that's right. Sorry.
Yes. So this was an individual who was clearly aware of their symptoms and their travel history. Very, very limited contact. Again, it's a small household, not a very big household. And the main source of exposure was with a family member who actually transported the individual privately from the airport to home. That was it.
And we understand the family member actually wore a mask during that
Yes,
time.
indeed.
So they took all precautions.
Indeed.
Can you talk about the reasoning behind allowing the woman to self-isolate rather than just keeping her at the hospital instead?
Yeah, perhaps I'll speak to that. I mean, we have actually done that with the previous cases as well, except for case one, who required hospitalization. So the decision to hospitalize or not is a clinical one based on the patient's clinical status. Do they need to be in hospital for hospital care? If they do, that that is what's done. But of course, that's a huge strain on the hospital in terms of they need negative pressure isolation room. The staff have to wear extra protective equipment, and again, it's a strain on the hospital. So it would be impractical and very negative for people's health care if every case were hospitalized. On the other hand, these people are very responsible. We ask them to self-isolate. We explain what's involved. And the local health department supports them in every way possible to make sure that they can maintain that and they're watching for signs and symptoms.
When do you expect the results to come back, whether it's confirmed or not, for this case?
We understand they've received the specimen. We're waiting for an answer later on today.
I'm just going back to an earlier question from Allison and see about Dr. Was this person was in Wuhan before or after the quarantine happened?
Prior.
Prior to, and then the other province she went to, it's also been quarantined, is it not?
I'm not certain about that, but I can tell you that the individual was elsewhere in China and departed from Beijing.
I don't know if you guys can talk about some of the stuff that happens at the airport, but because we see spikes in different countries that we talked about, when people are returning from those countries, so Italy, South Korea, whatever, does the approach at the airport change as well when people are returning, or are you still relying on people to kind of self-regulate themselves?
That's where we'll be working with our federal partners. As they put that forward, they'll say then now these become areas of concern, and they would change the messaging at the airport for those sites as well. And that's going to be a fairly, I would say the next while, a dynamic list as some come on and come off the list. And that depends if the World Health Organization and Public Health Agency of Canada are convinced that the country has been able to contain, or if there's a risk of travel and spread, then we'll add that to our list of risk areas to notify those people to fill out information accordingly, and we'll follow them.
The fact that this is another person in their 20s, does that indicate to you that there's no like specific profile of people who are contaminated? Is that worrisome?
Well, the information from China, as they're catching up, is that a lot of young people have been infected and have very short course and very limited mild infections. They seem to be able to throw it off fairly quickly, less than the 14-day time period. But in this case here, that doesn't mean they can't have some residual, like a dry cough type thing afterwards. And the test can remain borderline, because remember, the test picks up particles or bits and pieces of the RNA that could remain in the person's, say, nasal pharyngeal passage for a while. It doesn't mean they're actually infectious, but we want to be careful. So we wait until we get those two negatives, as Dr. Davila said, before we release them from isolation in that light. So you're seeing a varied picture in there, and it looks like a lot of the people, younger people, it's not a very severe illness in their case, but they can be the source of spread while they're mildly symptomatic in that, and so we have to take the precautions accordingly.
And is there a risk of it coming back for someone who got over the virus?
Very early to say on that, because we'd like that answered as soon as possible. Intuitively, we'd say they probably have immunity, but we don't know that, and especially some of the older people who seem to have less capacity to mount immunity. So there's many questions to be asked in that regard. So we haven't heard an official position from the WHO and epidemiological investigations at this time. We're asking that question. If you see the abating levels in China, one would get a sense there seems to be some building up of community immunity, if I could use that term, as the numbers seem to be dropping down in those epicenters. So it might convince you that there is a lack of reinfecting in some of the healthier population. But again, we have not heard that formally declared by the scientists yet at this stage.
How concerned are you about this spread in countries outside of Canada? And at this point, do you think it's warranted to call it a pandemic?
Well, we're always concerned. That's the Director General was concerned. That's why they made that declaration, especially where some of the countries do not have the infrastructure and capacity to undertake timely investigation, control measures, etc. And all the time we're wondering, when is it moving towards that pandemic picture? For us, it's not whether it's an on or off. We keep ramping up our pandemic response as is appropriate, on the assumption that it could go to that, but we want to make sure our response is timely, is appropriate, because you do not want to exhaust your resources inappropriately ahead of time, but at the same time, you do not want to not be ramping up and be caught off guard. So there's a balance and a continual dialogue at our level and with the federal, provincial, territorial level to ensure that we're as tuned into it as we can and waiting for those updates. So we're always monitoring.
What changes if it is declared a pandemic?
Well, for us, I mean, we already have our pandemic plans, and that's we would roll it up. If it's a world pandemic situation, the key is that is it actually moving from person to person within your jurisdiction? That changes your picture. If you're starting to see person to person and you're not able to contain in your areas, then you have to look at it differently. And that each country is going to have to respond on their own merit on that one. And because we're such a global center and travel, we're very much tied into other areas. With that then mean there's more limitation. But you always want to know, is there actually spread occurring in your respective jurisdictions? That changes your programs, your plans, and how you're handling that. So our pandemic plan is Ontario specific. It's tied to the national one, which is tied to the global one. Not everybody moves at the same time. And some are ramping up and some are ramping down, but you always have to make sure that you're in tune with the rest and you're moving appropriately in what you're facing in your own jurisdiction.
How are you feeling about how we've been able to sort of contain this here in the province of Ontario?
I think, as Dr. DeVille has alluded to and Dr. Yaffe, you can see the system in Ontario, everybody's doing as they're supposed to do. These are lessons learned from SARS. We built over 10 years to put this thing in place. So that's working well. That means then I feel good about the risk is still low, very low for Ontarians, and yet now we're asking ourselves, now what's our next step? What are we doing next? And we're having those discussions as we speak, so we're never just sitting and resting on our laurels on that. We're continuing to ask those questions. All our scientists are, because that's part of the system in Ontario. We have lots of experts who are involved and engaged and have comments to put on this, and those are valuable inputs, and not only but informs us as what is the proper and appropriate response to Ontario at this time and to be prepared.
Okay.
Thanks much.
Before you guys head out, we can confirm